Top 25 Pharmacy Technician Interview Questions and Answers. In the competitive field of pharmacy, preparing for an interview is crucial for aspiring technicians. This video will guide you through the top 25 interview questions commonly asked, along with effective answers to help you stand out. Understanding these questions will enhance your confidence and improve your chances of success. Whether you're a seasoned professional or new to the field, this information will equip you with the tools needed to excel in your interview. 1. Why did you choose to become a pharmacy technician? I chose to become a pharmacy technician because I have a passion for healthcare and helping others. Working in a pharmacy allows me to combine my interest in medicine with my desire to support patients in managing their health. I appreciate the role of a pharmacy technician in ensuring accurate medication dispensing and providing essential information to patients. The dynamic environment of a pharmacy, along with the opportunity for continuous learning about new medications and healthcare practices, keeps me motivated and engaged in my career. 2. How do you ensure accuracy when filling prescriptions? To ensure accuracy when filling prescriptions, I follow a systematic approach. First, I carefully review the prescription for any potential errors or ambiguities. I double-check the patient's information, medication name, dosage, and quantity. Next, I utilize technology, such as barcode scanning, to verify the medication against the prescription before dispensing. I also focus on maintaining a distraction-free environment during the filling process. Additionally, I consult with pharmacists if I encounter any inconsistencies or have questions. Regular training and updates on best practices further enhance my ability to maintain a high level of accuracy. 3. Can you explain the process of prescription processing, from receiving to dispensing? The prescription processing begins when a prescription is received, either in person, electronically, or via fax. The technician reviews the prescription for completeness and accuracy, verifying patient information and medication details. Once verified, the prescription is entered into the pharmacy management system. The medication is then selected and prepared, including any necessary calculations for dosage. After the preparation, the prescription is checked for accuracy by a pharmacist before dispensing it to the patient. Finally, the patient receives counseling on medication usage, potential side effects, and any other relevant information. 4. How do you handle a situation where a patient's medication is out of stock? When faced with a situation where a patient's medication is out of stock, my first step is to inform the patient about the situation and apologize for any inconvenience. I then check our system for alternative medications that may be available or consult with the pharmacist regarding possible substitutes. If no alternatives are suitable, I would contact nearby pharmacies to see if they have the medication in stock. Finally, I ensure to communicate any expected timelines for restocking and offer to assist with reordering the medication as needed. Keeping the patient informed is essential for their trust and satisfaction. 5. What steps do you take to maintain patient confidentiality and privacy? Maintaining patient confidentiality and privacy is crucial in a pharmacy setting. First, I ensure that patient records are securely stored and access is limited to authorized personnel only. I make it a point to discuss sensitive information discreetly, away from public areas. Additionally, I always verify a patient's identity before providing any information or medications. Regular training on HIPAA regulations helps keep me informed about best practices. Finally, I encourage patients to speak privately if they have concerns, reinforcing their comfort and trust in our services. 6. How do you stay updated on new medications and changes in pharmaceutical regulations? Staying updated on new medications and changes in pharmaceutical regulations is crucial for a pharmacy technician. I regularly read industry journals, subscribe to newsletters, and participate in continuing education courses. Attending workshops and webinars hosted by professional organizations helps me gain insights into emerging drug therapies and regulatory updates. Additionally, I engage with colleagues and pharmacists to discuss recent developments. Utilizing online resources and databases also aids in keeping my knowledge current, ensuring safe and effective patient care. 7. Describe your experience with handling and documenting controlled substances. Handling and documenting controlled substances is a critical aspect of my role as a pharmacy technician. I ensure strict adherence to regulations by meticulously documenting every transaction, including inventory counts and patient prescriptions. For instance, I maintain a log for each controlled substance, noting the date, quantity dispensed, and patient information. I have also participated in regular audits to verify that our records align with state and federal requirements. Training on the importance of security and accuracy has equipped me to manage these substances responsibly and ethically, ensuring patient safety and compliance with the law. 8. How do you prioritize tasks during busy periods in the pharmacy? During busy periods in the pharmacy, I prioritize tasks by first assessing the urgency of each situation. Prescription orders that are due for pickup or have critical patient needs take precedence. Next, I focus on tasks that can help streamline workflow, such as organizing medications and preparing for incoming prescriptions. Communication with team members is essential, so I ensure we are all aware of our priorities. I also remain adaptable, ready to assist wherever needed, while maintaining attention to detail to prevent errors. Proper time management and a calm approach enable me to handle the demands effectively. 9. What would you do if you suspected a prescription was forged or altered? If I suspected that a prescription was forged or altered, I would first remain calm and discreet. I would verify the prescription details with the prescribing physician's office to confirm its authenticity. During this time, I would document all relevant information, including the patient's name, prescription details, and any observations that raised my suspicion. If the prescription is confirmed as suspicious, I would follow my pharmacy's protocols for reporting the incident to the appropriate authorities while ensuring that patient confidentiality is maintained. Communication with my team would also be essential to handle the situation appropriately. 10. How do you handle difficult or upset customers? When dealing with difficult or upset customers, I first prioritize active listening. I allow them to express their concerns without interruption, which helps them feel heard and valued. Once I understand the issue, I empathize with their feelings and reassure them that I am there to help. I remain calm and professional, focusing on finding a solution. If necessary, I involve a pharmacist or supervisor for further assistance. After resolving the issue, I thank the customer for their patience and feedback, as it provides an opportunity for improvement in our services. 11. Can you explain the importance of proper medication storage? Proper medication storage is crucial for maintaining the effectiveness and safety of medications. When stored incorrectly, medications can lose their potency, become contaminated, or even pose health risks to patients. Each medication has specific storage requirements, such as temperature, humidity, and light exposure, which must be adhered to. Storing medications in a clean, organized environment helps prevent mix-ups and ensures easy access for pharmacists and technicians. Additionally, proper storage reduces the likelihood of medication errors, ensuring patients receive the correct treatments as prescribed. 12. How do you ensure clear communication with pharmacists and other team members? Clear communication is essential in a pharmacy setting. I prioritize regular check-ins with pharmacists and colleagues to discuss prescriptions and any potential issues. Utilizing effective tools like shared digital platforms and notes helps maintain transparency. I actively listen to my team members, ensuring I fully understand their perspectives and concerns. Additionally, I ask clarifying questions when needed and encourage open dialogue among the team. This collaborative approach fosters a supportive environment where everyone feels comfortable sharing vital information, ultimately enhancing patient care and safety. 13. What experience do you have with pharmacy inventory management? In my previous role as a pharmacy technician, I was responsible for maintaining accurate inventory levels. I conducted regular inventory audits, ensuring medications were properly stocked and expired items were removed promptly. I utilized pharmacy management software to track inventory usage and reorder supplies when necessary. This helped prevent shortages and overstock situations. Additionally, I collaborated with pharmacists to analyze prescribing trends, allowing us to optimize stock based on patient needs. This proactive approach not only improved efficiency but also enhanced patient care by ensuring medications were readily available. 14. How do you educate patients on the proper use of their medications? To educate patients on the proper use of their medications, I start by ensuring they understand the purpose of each medication and how it works. I provide clear instructions on dosage, timing, and potential side effects. Using simple language, I encourage patients to ask questions to clarify any doubts. Visual aids, such as medication charts or pamphlets, help reinforce the information. I also emphasize the importance of adhering to prescribed regimens and inform them about what to do if they miss a dose or experience adverse effects, ensuring they feel supported and informed in their treatment journey. 15. Describe a time when you identified and corrected a potential medication error. During my time at the pharmacy, I once noticed a discrepancy in a prescription for a patient who was supposed to receive a blood pressure medication. The prescribed dosage seemed unusually high compared to what was typical for that medication. I took the initiative to double-check the prescription against the patient's previous records and consulted with the pharmacist. It turned out that the doctor had mistakenly written the wrong dosage. We contacted the physician to confirm the correct amount, ensuring the patient received the appropriate dosage and avoided any potential adverse effects. This experience reinforced the importance of vigilance in our work. 16. How do you handle insurance claims and billing issues? Handling insurance claims and billing issues requires attention to detail and effective communication skills. When a claim is denied, I first review the patient's information and the reason for the denial. I reach out to the insurance company for clarification and gather any necessary documentation to support the claim. Additionally, I keep the patient informed about the status and any actions they may need to take. If there are billing discrepancies, I work diligently to resolve them promptly, ensuring that patients understand their responsibilities while maintaining a positive customer experience. 17. What steps do you take to maintain a clean and organized workspace? Maintaining a clean and organized workspace is essential for efficiency and safety in a pharmacy. First, I establish a routine for cleaning surfaces and equipment at the beginning and end of each shift. I keep all medications and supplies neatly stored in designated areas, ensuring labels are visible and accessible. Regularly checking expiration dates helps prevent errors. I also utilize checklists for tasks to stay organized and prioritize. By decluttering my workspace and discarding unnecessary items, I create an environment conducive to accuracy and productivity. 18. How do you stay focused and avoid errors during repetitive tasks? Staying focused during repetitive tasks is crucial in a pharmacy setting. I employ several strategies to maintain concentration. First, I break tasks into smaller, manageable segments, allowing me to focus on one part at a time. I also take short breaks to clear my mind and refresh my focus. Utilizing checklists is another effective approach. They help ensure that each step is completed accurately. Additionally, I minimize distractions by keeping my workspace organized and quiet. Engaging in mindfulness techniques, such as deep breathing, helps me remain attentive and reduces the likelihood of mistakes. 19. Can you explain the difference between brand name and generic medications? Brand name medications are developed by pharmaceutical companies and are marketed under a trademark name. These drugs usually have a higher price due to the costs associated with research, development, and marketing. Generic medications, on the other hand, are copies of brand name drugs and contain the same active ingredients, dosage form, strength, and intended use. They are typically more affordable as they do not have the same marketing expenses. The FDA requires that generics meet strict standards for quality and effectiveness, ensuring that patients receive comparable treatment options. 20. How do you handle a situation where a patient is experiencing adverse effects from their medication? When a patient reports experiencing adverse effects from their medication, my first step is to listen carefully to their concerns and gather detailed information about their symptoms. I would reassure them that their health is my priority. Next, I would review their medication history and check for potential interactions or contraindications. If necessary, I would consult with the pharmacist to determine appropriate actions, such as recommending a change in medication or advising the patient to contact their healthcare provider. Ensuring the patient feels supported and informed about their situation is essential. 21. What experience do you have with compounding medications? I have hands-on experience with compounding medications during my training and previous positions. My responsibilities included preparing customized formulations for patients, such as creams, ointments, and sterile products, while adhering to strict guidelines. I am familiar with using various compounding equipment and techniques, ensuring the accuracy of measurements and maintaining a sterile environment. Additionally, I have collaborated with pharmacists to verify formulations and document the process meticulously. This experience has strengthened my attention to detail and commitment to quality in patient care. 22. How do you ensure you're providing excellent customer service in a pharmacy setting? Providing excellent customer service in a pharmacy setting involves several key practices. First, I prioritize active listening to understand patients' needs and concerns. I greet customers warmly and make sure they feel valued. Clear communication is essential, so I take the time to explain medications, dosage instructions, and potential side effects. I also ensure prompt service while maintaining accuracy. Addressing any issues or questions with empathy reinforces trust. Additionally, I follow up to ensure customer satisfaction, fostering a welcoming environment that encourages patients to return. 23. Describe your experience with using pharmacy management software. My experience with using pharmacy management software has been extensive. I have worked with various systems that streamline prescription processing, inventory management, and patient records. These software solutions enable me to efficiently input and retrieve prescription data, ensuring accuracy in filling orders. I have also utilized features for tracking inventory levels, which helps in managing stock and ordering medications as needed. Training sessions on new software updates have kept me informed about the latest functionalities, enhancing my productivity and allowing me to provide better service to patients. 24. How do you handle a situation where you're unsure about a prescription or dosage? When faced with uncertainty about a prescription or dosage, my first step is to double-check the information provided. I review the prescription for any potential errors or unclear instructions. If doubts persist, I consult with the pharmacist for clarification. Communication with healthcare professionals is crucial, so I may also reach out to the prescribing physician if needed. Patient safety is my top priority, and ensuring accuracy is essential. Keeping an open line of communication helps prevent any potential errors, ensuring that the patient receives the correct medication and dosage. 25. What do you think are the most important qualities for a successful pharmacy technician? A successful pharmacy technician should possess strong attention to detail, ensuring accuracy in medication dispensing and prescription processing. Excellent communication skills are vital for effectively interacting with pharmacists, healthcare professionals, and patients. Empathy allows technicians to connect with patients, understanding their needs and concerns. Additionally, problem-solving abilities help in addressing challenges, such as handling insurance issues or medication shortages. Finally, organizational skills are essential for managing inventory and maintaining a clean workspace, which contributes to a more efficient pharmacy environment. In this video, we've explored the top 25 pharmacy technician interview questions and answers that will help you stand out during your interview. Being well prepared for these questions not only boosts your confidence but also demonstrates your knowledge and dedication to the role. We hope these insights empower you to take the next step in your pharmacy career. If you found this information helpful, please give us a thumbs up and subscribe to our channel for more valuable content. Thank you for watching, and best of luck with your interview.